Okay, I got another request under the comment section, or in the comment section under my videos. Somebody wanted to know the differences between the various forms of testosterone, particularly that related to testosterone replacement therapy. Now, I'm not going to talk here about using testosterone as an ergogenic aid, such as anabolic steroid use in sports or bodybuilding. That's a whole nother topic. There's probably a million videos on that stuff, most of which is grossly inaccurate, but that's besides the point. Instead, here I'm just going to talk basically about the various types of testosterone preparations available and the advantages and disadvantages of each. Now, what about testosterone replacement therapy itself? It's usually considered appropriate for men who show total testosterone levels of below 300 nanograms per deciliter of blood. Now, the range goes from, in some cases, from some doctors will consider you normal at 300 and not even consider you for TRT or testosterone replacement therapy unless your testosterone levels are 200 or less, which is ridiculous because 200 or less is just about a eunuch. There's like no testosterone activity. Even 300 is actually not optimal whatsoever. It's barely normal. In other words, you're not in a full-fledged testosterone deficiency, but you're not getting a lot of the benefits of testosterone with a level of 300. That's basically what I call an old man's level. In other words, you'll have about as much vigor and strength as an old man with a testosterone of 300. But again, that's another story. Many men, however, seek testosterone replacement therapy or TRT because of their perceived symptoms of what they call low T. That's the popular expression. This includes the various symptoms include depression, erectile dysfunction, lack of sex drive, fat accumulation in the abdominal area, loss of muscle mass, and others. The problem with this is that these same symptoms can occur with many other things besides a lack of testosterone. They are not specific for a lack of testosterone. And quite frankly, I do have to agree, a lot of men jump on testosterone therapy before it's actually needed because of their perceived need. In other words, if they feel they're not gaining enough muscle in the gym, let's say they're 40 years old or over, a lot of the guys will immediately say, well, I'm low on testosterone, I got to get on testosterone. Well, that's faulty thinking, because there are ways if you're to increase testosterone, which I talk about in my Applied Metabolics newsletter and in previous videos, which don't necessarily involve getting on testosterone itself. You should try those first. You should also consider, if you're like borderline low testosterone, you might consider less invasive forms of testosterone therapy, which involves not using testosterone, which I also had a huge article on in my Applied Metabolics newsletter. This involves using things like Clomid, the drug Clomid, or HCG, human chorionic gonadotrophin. These things can actually push you to the point where you have pretty good testosterone levels without having to get on testosterone. This could be very advantageous for those who want to maintain fertility or still young enough where you might want to have children. You should look at that first. If that doesn't work and your only option is testosterone therapy, then you go to what we're going to talk about here, the various forms of testosterone. When testosterone levels decline, related to muscle, it is more difficult to build muscle mass. As a matter of fact, they had a study a couple of years ago. This involved young men who were not deficient in testosterone, but they gave these young men a drug which basically blocked the release of luteinizing hormone in the brain, the anterior pituitary gland in the brain. Luteinizing hormone controls testosterone synthesis at the level of the Leydig cells in the testes. When they gave young men, they were about 25 years of age, some of them were 20. They gave them this drug to block luteinizing hormone. Of course, their testosterone dropped to nothing, dropped to levels like that of like an 80 or 90-year-old man. Now, these guys are still working out in the gym, and what happened was they made no gains at all. When the testosterone declined, all muscle gains stopped. Strength and muscle gains stopped. So you can see the importance of testosterone for muscle. Now, a lot of people wonder, well, how high should my testosterone level be to build or maintain muscle? To build muscle, You need a total testosterone level of about 800, 750 to 800 to really effectively build muscle. Any more than that, doesn't really make that much of a difference. A couple of years ago, famous New England Journal study showed that giving 600 milligrams of testosterone a week led to significant gains in muscle mass. And men who weren't even working out, they still gained muscle mass. And that was the study that once and for all destroyed the myth of whether testosterone affects muscle gains. And that was back in 1996, I believe it was. Now, you can maintain muscle mass with a total testosterone of about 500. That's enough to maintain muscle mass. And when you take the most common testosterone preparations, such as the gels or the topical creams or lotions, that kind of thing, those are designed to bring your testosterone up to midpoint normal, which is about 500. In other words, 500 will, maintain most of the functions of testosterone, and it will maintain muscle mass, but it's not conducive to building added muscle. For that, you need to have a level of 800, and to get that level of 800, usually in most cases, requires testosterone injections. Now, some people shouldn't even think of having testosterone therapy. There are certain contraindications. For example, if you have existing prostate or male breast cancer, you don't want to take testosterone because it stimulates growth of cancers. The prostate is a little iffy, probably not as much. If you have a nodule on your prostate that can be felt during a digital rectal examination by a doctor, you should also be careful about having testosterone therapy started. If you have a prostate-specific antigen level of greater than 3 nanograms per milliliter, you also have to be very careful of going on testosterone therapy. You need to be checked further. If you have a hematocrit, what is hematocrit? Hematocrit is a measurement of the viscosity or the thickness of the blood, having to do with the amount of red blood cells that are circulating in the blood. The more red blood cells, the thicker the greater the viscosity of the blood itself. Unfortunately, having a higher hematocrit is related to increased internal blood clotting in the blood, which is also a risk factor for strokes, heart attacks, and pulmonary embolism. So if you have a hematocrit greater than 50%, usually the figure is actually 56% is the danger point. When you have a hematocrit of 56 or more, you're in a much greater risk of having a stroke or a heart attack. And I'll get to that later, a little bit more about that. If you also have untreated obstructive sleep apnea, which is a cessation of breathing while you're sleeping, usually it's accompanied by heavy snoring. Usually when you lie in the back, what happens is the kind of throat closes and you literally stop breathing for a couple of minutes. It's associated with high blood pressure and strokes. But, you don't want to, when you first get on testosterone, if you already have sleep apnea, it can make it worse. So you got to be careful of that too. If you have severe urinary tract symptoms, also you shouldn't go right on testosterone. And if you have class 3 or 4 or advanced heart failure, again, you can't really go on testosterone therapy unless that's treated first. Although it was previously thought that the best time to administer any form of testosterone was in the early morning, because testosterone in most men peaks between 7 and 8 a.m. That's when testosterone is at its greatest peak. And so they used to say, well, if you're going to have your testosterone measured, in other words, if you think that you lower testosterone, you go and have lab tests for testosterone, and the previous advice was to have it measured early in the morning to capture the testosterone peak, and you would have it measured 3 times to make sure that the first one might have not been an anomaly. Like, let's say you didn't get enough sleep. If you didn't get enough sleep, you're going to show low testosterone, even if you have otherwise normal testosterone levels. So they recommend usually 3 different testosterone tests, and if all 3 of them show low, then you're a candidate for testosterone replacement therapy. But now they know that it really doesn't make that much of a difference when you have the blood test done. It doesn't make any difference, because the difference in testosterone levels throughout the day is so minuscule that it doesn't mean anything. What's the best form of testosterone to use? Well, that depends on individual needs and responses. Some people just can't handle injections at all. They just can't. They're afraid of needles, whatever. Obviously, injections are not going to be for them. And there's another reason why doctors don't like to give out injections, which I'll talk about in a minute. But to obtain the highest blood levels of testosterone does require injections. There's no other form of testosterone therapy that's going to give you the really what they call superphysiological levels of testosterone, which, in other words, that actually goes over the standard, what do you call it, scale for testosterone. With the injections, you can get it over 1,000, which is anything over 1,000 is considered superphysiological. Now, it's not really good to maintain that high level of testosterone constantly because nobody knows the long-term effects of maintaining really super high levels of testosterone. There's some indications that it could be bad for your heart, but that's right now it's not. It's more of a theory than a fact. But it's best to keep it within the physiological range, which is again from 300 to 1,000. If it's in that range, the body accepts the testosterone as normal, and you don't really get any side effects usually. As far as the injected forms, there are actually two main forms available. These are testosterone enanthate and testosterone cypionate. Now, you read a lot of articles where especially on the web, where these so-called steroid experts, so gurus, they make claims that enanthate is better or cypionate's better. But the truth is, from a scientific point of view, there's almost no difference between the two. Very, very little difference as far as physiological effects of testosterone. Anecdotal reports, this is not scientific evidence, but anecdotal, some people say enanthate is a little bit more irritating to use. In other words, the injection site it gets a little more irritated with an enanthate than cypionate. So generally, cypionate is a slightly more popular form, but as far as physiological effects, they're practically identical. The injections are usually provided in doses that range from 100 to 200 milligrams. This is testosterone therapy. We're not talking about ergogenics. They're provided every 2 weeks. However, testosterone injections peak in 48 hours, after which plasma levels of testosterone gradually decline. As such, it makes far more sense to inject testosterone at least once a week. Usually, it's given intramuscular. It can be given in the shoulders. It can be given in the vastus of the thigh muscles, or it could be given in the most common area, which is the butt. And you all want to alternate injection sites, so you don't irritate the area. In other words, 1 week you can give it in the deltoid right here in the middle. You can give it in the thigh the next week, or then the butt the next. Or if you're going to just give the injections in the gluteus, you alternate one side from the other. That lessen the need of injections. I remember I got a laugh a couple of years ago. There was one doctor who specialized in testosterone therapy, who was a big proponent of subcutaneous testosterone injections, which I'll talk about in a minute. But he said that one of the big problems with intramuscular testosterone injections is that if you keep giving it, it pokes holes in the tissue over many, many years. You're going to have all these microscopic, holes in wherever you inject. For a doctor to say this was just laughable to me, because what he's saying is that, the holes made by the injection stay there. They don't heal, which is absolutely absurd. A third grader should know better than that. But that's another story. I don't want to get into that part. But anyway, some bodybuilders, as you know, most of the people watching this know, some bodybuilders are known to take 2,000 milligrams or more a week. I read that the late bodybuilder Dallas McCarver, young pro bodybuilder who died at age 26, he was supposedly injecting 15,000 milligrams a week, which is completely insane. Completely insane. Anyway, to inject more than 2,000 milligrams makes no sense from a physiological point of view, since the human male body produces, you ready for this? The human male produces from 9 to 11 milligrams of testosterone a day. That's it, 9 to 11 milligrams. So what happens when you inject 2 or 3,000 milligrams a week? Well, what happens is that, your body will note the increased testosterone. It'll open up new androgen receptors. You have to have androgen receptors, or else testosterone does nothing, because it interacts with androgen receptors. Your body will open up new androgen receptors up to a point, but there is a limit to how many androgen receptors could be opened. So a lot of that testosterone that these guys are using is not doing a damn thing. Let me amend that. It is doing something. it's greatly increasing the risk of side effects. In other words, the side effects can include acne, lowered blood lipids, lowered HDL, elevated, blood pressure. A lot of cardiac risk factors are raised when you have, inject excessive amounts of testosterone. And while smaller amounts of testosterone are actually protective against cardiovascular disease onset, but it works in reverse. When you take larger doses, again, it's what they call hormesis. Smaller doses are protective. Once you get past a certain point, the same substance or activity becomes negative, harmful to health, and testosterone falls into the hormesis category. Those of you who are worried about estrogen, a lot of people will take a aromatase inhibitor such as Arimidex when they take testosterone injections, because they know that a certain percentage of the testosterone injection, maybe 8 or 10% of it, will be converted into estrogen, and they're worried about estrogen-related side effects such as gynecomastia and others. However, when you a lot of the cardiovascular protection given or offered by testosterone injections is because some of that testosterone is converted into estrogen. It's actually the estrogen component along with the testosterone that conveys cardiovascular protection. And when you use an aromatase inhibitor with a testosterone injection, you're basically erasing the cardiovascular protection offered by testosterone. So keep that in mind. Some of the possible side effects of testosterone replacement therapy include, as I said, elevated hematocrit levels, acne, reduced sperm count, and infertility, testicular atrophy, which is basically a shrinkage of your balls, gynecomastia, male breast formation, induction of male pattern baldness, which is not actually caused by testosterone, it's caused by testosterone metabolite or byproduct dihydrotestosterone, and sleep apnea. The testicular atrophy and infertility that's produced by testosterone can be prevented by injecting human chorionic gonadotrophin, which is always in injectable form. To use a low dose, 250 milligrams, taken 2 days before an injection of testosterone, will offset the infertility caused by testosterone, will also prevent the shrinkage of the testicles. You don't want to take much more than that because large amounts of HCG, if you take them too long, they cause your testes to become blunted to the effects of luteinizing hormone and HCG. So after a while, large amounts do nothing except stimulate estrogen, which is what you don't want. A more recent trend in testosterone injections involves subcutaneous injections, injecting smaller doses such as 50 milligrams about 3 times a week. Using the subcutaneous method is thought to prevent the rise in estrogen or minimize it that can occur at larger doses of T, and also limits the production of DHT along with its side effects such as male pattern baldness and acne. Now, the way they do this, they use like an insulin needle, and they inject it like just so you would do it insulin right under the skin. I'm not sure how you get testosterone, which is usually found in a kind of a thick oil. I'm not sure really. I've never done this, or I've never seen it done myself. How the subcutaneous, how they get it into that little needle, but apparently some people do. I guess there's videos on YouTube telling you how to do it. But some people who I've spoken to, who've used the sub-Q injections, they report a lot of irritation around the injection site to the point where it becomes intolerable, and they go back to the regular, usual intramuscular injections. And another problem with the sub-Q injections is that you have to inject it at least 2 to 3 times a week, to maintain the levels of testosterone, because you're taking much smaller doses. A lot of people just don't like taking any injections. It's inconvenient. Even subcutaneous, which are relatively painless. Perhaps the most common side effect of injected testosterone is, without a doubt, elevated hematocrit. And this usually occurs when doses of more than 150 milligrams of testosterone a week are used. It's far more common in men over age 40. Very rarely happens in younger men. The cure is simple. Donate blood. As soon as you donate blood, the hematocrit goes down. On the other hand, more recent studies have found that elevated hematocrit related to TRT Tends to level off after 6 months of continued usage. In other words, your body adjusts to the testosterone, your hematocrit goes back down to normal. But if your hematocrit is over 56, that calls for blood donation to prevent heart attack or stroke. You don't want to maintain a high hematocrit for extended times. It's extremely dangerous. The newest form of testosterone injection is called testosterone undecoinate. Kind of similar in some ways to decadorablin, which is dorablin undecoinate, which the undecoinate indicates it's a very long-acting ester form. It lasts a long time. This particular long-acting form of testosterone is called Nubid or something like that. The trade name is Avid. It's a long-acting testosterone that requires injections every 12 weeks or only 5 injections a year. It does not produce supraphysiological levels of testosterone. Thus, it is not the best for those seeking muscle gains. It'll maintain a steady kind of midpoint level like the topical preparations, but it doesn't. And the convenience is that you only have to take a couple injections a year. You don't have to put on rub on testosterone daily or that kind of stuff. But like I say, it's not going to give you super high levels of testosterone. There's a nasal form of testosterone that offers the obvious advantage of no injection. You use it 3 times a day, which is inconvenient for many, but after administration, the testosterone levels return to normal in only 40 minutes. The half-life of the drug, or the amount of time it takes to break down half of the initial dosage, varies from 10 to 100 minutes, depending on the absorption characteristics, how well the person uses it, how much of it's absorbed. Side effects include nasal and throat irritation and headaches. Testosterone can also be provided in a buccal form, which is basically you stick it between the gums and kind of put it right up here against your gums and your cheek. It gradually melts, and this gradually releases the testosterone. The tablet contains 30 milligrams of testosterone, and a 12-week study found that it provided steady testosterone levels in 86.6% of subjects. The most common side effect was gum irritation and a kind of bad, bitter taste in the mouth. But this happens in about only 10% of those who use it. When compared to topical drugs such as androderm, Striant, as the drug is called, proves superior in maintaining testosterone levels for longer times. With androderm patches, testosterone levels dropped after 2 hours of application. The androderm transdermal patch is available in 2 strengths, 2 and 4 milligram. It's applied to the skin anywhere except the scrotum, and it's replaced every 24 hours. It produces normal T levels in 92% of patients. When compared with testosterone injections, androderm produced normal T levels in 82% of patients, compared to 72% in those who use the injections. On the other hand, you got to realize that the injections release testosterone much slower than the androderm patches, so that really was a kind of silly study. But 37% of those who used the patches showed excessive itchiness, and 12% showed a burn-like blister on their skin. Testosterone is also available as gels, packets, and in tubes. Androgel is one such preparation. The main problem with the gels is transferring it to women and children. In other words, it stays on your skin. If you come in contact with if it rubs on a woman you're with or a child, they're getting testosterone because it goes right through the skin. There's been some rare cases of masculinization of children who their father put on, let's say, androgel. Somehow the androgel got on the child and it caused them to have masculinization symptoms. Same with women. There have been cases of testosterone being transferred from males to females while having sex. So, the guy will have sex with his wife, and with a couple of months of this, if he's not careful, his wife starts to have a deeper voice, maybe even grow a little hair in the face. Not good. You got to be careful. If you put on the gel, make sure you have a shirt on or something covering yourself if you come in contact with women and children. Testim gel has the least tendency to be transferred of all the gels. The brand called Testim has the least. Even there, you have to keep it covered. In efficacy, these gels are similar to nasal and patch forms of testosterone. Axiron is the most effective gel form, producing normal T levels in 89% of subjects. Axiron is applied only to one area, under the armpits. You use it like you use an underarm deodorant. You put it right under the armpits. Axial, they call that. That's probably what it's called, Axiron. Anyway, there's one testosterone drug topical called Fortesta that showed the highest rate of side effects, usually skin irritation, and it happened in 17% of subjects who used it. Keep in mind that topical drugs are not likely to raise testosterone to physiological levels as can the injections. In other words, the topical gel forms, whatever patches, they are not designed to help you build muscle. They're merely designed to help you maintain midpoint normal levels of testosterone. The final form of testosterone that I'm going to talk about is implanted pellets. They implant pellets under the skin. This has to be done by a doctor. It's a minor surgical procedure. The pellets last about 5 months. They don't have to be removed because they dissolve on their own. The problem with that is once you have the pellets under there, you can't really adjust the dosage. So if for some reason the pellets aren't producing enough of a level of testosterone, or they're producing too much, well, then you got a problem because there's nothing you can do. They're under the skin. You got to just wait for them to dissolve. I would suggest that the pellets are probably the least popular form of any testosterone preparation. I personally have met men who've used just about every form I've discussed in this video. I've never met a man yet who has used the pellets. I wouldn't recommend it because of the reasons I just said, which is variations in testosterone levels that you really can't control once you have the pellets implanted. So that's about it for comparison of various forms of testosterone. If you want to have the best and most accurate information on nutrition, exercise science, ergogenic aids, hormonal therapy, including this new information about testosterone as it comes out, anti-aging techniques you can use today, fat loss methods that really work, women's health and fitness, exercise science, many more topics. Subscribe today to my Applied Metabolics newsletter, www.appliedmetabolics.com. It's 40 to 50 pages every month, no advertisement, just evidence-based information, including my 58 years of empirical knowledge and studying, which can't be matched by anybody in the industry, by any other digital publication. Comes out once a month. Usually it's available on the first of the month. When you subscribe, I will send you an invitation to join my private Applied Metabolics Facebook page, where every day I put new information on nutrition, exercise science, medicine, and general health every single day. Really interesting stuff. I also answer questions on that Facebook page. I also have a email portal on my Applied Metabolics page where current subscribers only could ask me questions, make comments on some of the articles, or ask about if they're confused about anything I wrote, which isn't likely, since I write for people that are at a 6th grade level of education, so that it's universally understandable by anybody who can read, who's literate. It is fairly long because I go into extreme detail in every article, and I can tell you after about a couple of months of reading Applied Metabolics, you yourself will be an expert on nutrition and exercise. It's a great resource for trainers or anybody who wants the most in-depth information. You're welcome to leave comments under these videos, including suggestions for future videos. Like this video was left as a suggestion, meaning they wanted information on the comparison between various testosterone preparations. I will try and accommodate that if I can. If I feel that a wide variety of people would be interested in the subject, I will do a video on it. You can leave questions if you want. I can't guarantee that I'll answer the questions. Sometimes I do, sometimes I don't. But I will always answer questions submitted to me by my current subscribers. So that's about it. If you want to have the best friend you'll ever have, go to your local shelter, adopt a dog, and thank you for listening. Take care.